739 News at 4:30.
Silicone breast implants will not be making a comeback, at least not in the near future. The Food and Drug Administration has rejected a request to bring the implants back on the market. The decision comes just a few months after an FDA advisory committee recommended that the ban on silicone implants be lifted. Silicone breast implants were banned 11 years ago because of safety concerns.
Many plastic surgeons disagree with that FDA ban, saying silicone implants are safe and for years have been routinely used for breast reconstruction and mastectomy patients.
Medical correspondent Peggy Pico joins us with more on this controversial story, of course.
It's controversial because many critics, as you say, claim that the silicone implants are unsafe, even with high-tech improvements. But leading plastic surgeons disagree, and so does one San Diego woman who switched her so-called safe saline implants to silicone.
Yeah, well, they feel natural. And, you know, they drape more naturally, too.
Kimberly Sabalos switched to silicone implants 2 years ago after her so-called safe saline implants caused problems.
I became encapsulated with the saline implants.
What does that mean?
Well, scar tissue builds up around the implant, and it can get hard, and it contracts, and it was painful.
Either type can hurt, but the FDA's 11-year ban on marketing silicone in the U.S. comes from widespread complaints that leaking and ruptured silicone implants made women sick.
Understanding breast implant rupture rates, not just the rates, but also understanding what the consequences are when there is a rupture.
Some doctors say the new silicone implant is safer because it has a 3-layer shell that prevents it from leaking and stops it from rupturing even in traumatic situations.
The shell's a lot thicker and it's cross-linked in a manner such that it prevents the gel from bleeding through the implant.
Board-certified plastic surgeon Munish Batra prefers silicone implants and says so would most of his patients.
And if they have thin skin, they'll see the rippling, and that's of course distressful to them. Whereas with the gel implant, same size implant, there's no rippling because the gel's more viscous and it fills out those ripples.
The FDA allows silicone for breast reconstruction in cancer patients and for women like Kimberly who've had problems with saline in the past.
I don't understand it. I don't understand how can you give a woman who's had cancer and had a mastectomy silicone implants, and that's fine, but not someone who's perfectly healthy.
It's a question many women and doctors want the FDA to answer. Silicone is used in breast implants in many countries, but today the FDA said it wants more information before it will allow silicone implants to be used once again cosmetically here in the U.S.